Welcome to Fempower Health. Our healthcare system wasn't designed with women in mind, and the consequences show up everywhere in research, provider training, reimbursement, and access to care. So today I am joined by Joanna Strober, who is a serial entrepreneur and the CEO of Midi Health. And we're here to discuss what it really takes to build a women's health company inside this broken system. So, whether you're a clinician, researcher, innovator, or a woman navigating care yourself, this episode will give you the systemic insights you need to understand why progress in women's health is so hard and where change must happen next. So, let's dive in. Welcome. It is such a pleasure to have you here today.
Thank you. I'm looking forward to this conversation.
Let's first start with your inspiration behind focusing in midlife women's health specifically.
You know what? I think a lot of attention has gone to women as baby machines.
Yes.
And there is a lot of attention, and it's really important. Birth, fertility, all those things are really important. But a lot of women do get lost to medical care after having children. They start focusing on their children. Perhaps they're focusing even on their spouse, and they're not focusing a lot on themselves. And so a lot is happening to our bodies in our 30s, 40s, 50s, 60s. And I found that a lot of women just don't understand what's going on. They don't take the time to take care of themselves. And the things that you do in your 40s and 50s have a huge impact on your life in your 70s, 80s, beyond. My goal is to really help women to understand their bodies better in their 30, 40, 50s and to make sure they get really good medical care that can enable us to age healthier.
No, absolutely. And it's funny you say this. So I started in the women's health space in the more reproductive area, fertility, et cetera. And you're right, there is so much focus in those years, whether or not you want to have children, right?
Right.
And so many of my friends, even so I'm 51, have said, what happens after we have kids? Like, I don't even know what we do. And right now, thank goodness for the celebrities, et cetera, perimenopause and menopause is like all the rage right now. It's a huge moneymaker, multi-billion dollar industry. But what I like is that we're starting to evolve into this term midlife. And I think that is so incredibly important because my concern, and I don't want to get this into perimenopause, menopause, but the point I'm trying to make is like the systemic issues in healthcare. Because this is just an example, if we name a condition a certain way, it kind of drives how we think about the healthcare system. And I believe when we narrow things to perimenopause, menopause, I think the mind goes to hormone therapy. And midlife is so many different aspects, right? And the challenges in our healthcare system, things are so siloed. So for your heart troubles, you may go to the cardiologist, right? And OBGYNs are kind of the default for women's health, but they can't know everything, right? And are they referring out as needed? So I'd love to understand like what you've seen in navigating this space of midlife and those challenges because you're in the telehealth space, but you're probably doing a lot of referrals out. So I'm sure you see a lot of those dynamics play out in the healthcare system.
Yeah, so there's a lot there, right? I mean, we call the company Midi because it's midlife, right? And our goal is to be a midlife care company. I kind of joke sometimes that our providers are pediatricians, right? We have pediatricians, we have obstetricians. What's next? What are the people to take care of us in that next stage of life? And it's exactly what you just said, which is there's primary care and then there's specialists. And maybe there's an endocrinologist, or maybe there's a cardiologist, or maybe there's a neurologist, but everything is taking care of a little part of our body or our heart, right? But it's all one body, it's all one machine, right? And so I think that a lot of the healthcare system has evolved to take care of things very piecemeal, and we need to put it all together in one place. And so a lot of what I've learned researching all this, right, is when you think, I mean, and it's why I don't call us a menopause company, right? But when you think menopause, you're not thinking about your bones, right?
Right.
But but very much it is related. As your hormones decrease, your bones get weaker. if you don't do things in your 30s, 40s, 50s to have stronger bones, you're going to become a scruncher over old lady, which none of us want to become. It's the same thing, you now can get blood testing to find out if you have a gene for Alzheimer's, right? You should be getting that testing so that if you know that you have a genetic predisposition to Alzheimer's, there's things you can start doing again in your 40s and 50s that can make an impact on whether you get Alzheimer's. So a lot of it is what you were talking about. You need the data, you need the research, and then you need proactivity so we can help women to be more proactive about their healthcare. And so, I think there's this very strange concept. I mean, I joke that actually menopause is like a marketing term more than anything else at this point. So, as you know, Georgie, all that menopause means is that you haven't had your period for a year, right? So that's it. So I wear my t-shirt that says, menopause is hot, and I'll be on an airplane. The flight attendant said to me, "I'm so happy that's over." I'm like, "No, no, no, you don't understand." I mean, I can't say this to her on the airplane, but people say this to me all the time. "I'm so grateful that's over." I'm like, "It's not over.
It's n
Your period is over. But
correct.
you are not finished aging.
Yes.
We are very much unfinished. And just because you don't have your period does not mean you've stopped." And so we have this weird idea that menopause, period, over. But this is all just women's health.
Yes.
It's all about what are the things that we can do to take care of our bodies, to keep strong, healthy, proactively, and age healthier. So that's what I'm really thinking a lot about.
Yeah, no, absolutely. And by the way, I do wanna share this data point because I know a lot of people will be listening to this episode. So and just wanna get this data point out there because it's mind-blowing. So I don't remember the exact numbers, but basically, even only 50 years ago, the speed at which new information came out for physicians was, I think, like 50 a year, 50 new things, and now it's like it's accelerated like a hundredfold in the new information that they have to track. And so, I just wanted to share that just so people understand how hard, like, this whole healthcare system is. And so what I would like to differentiate now is we all know the healthcare system's frustrated. We're all incredibly annoyed by it, but it's especially unique for women's health, right? So how is it that companies can build businesses in it? Because a lot of the things that I've seen is a lot of things are cost savings and optimizing systems. And perhaps I have this eye for it because as a consultant, my superpower is like process optimization and transformation work. But I do see a lot of that. And then there are these wonderful innovations, and you've done them, you've invested in them. Why is it so difficult, to take this and invest in it and build these companies? Because we're seeing the need. We see a need for innovation even in this space of midlife. So why is it so hard?
So we are a women's health company, but I want to say that it's not just women's health, it's men's health
Okay,
too. So
it
I
is.
don't it's not like men have easy access to doctors who know everything about their bodies and can take care of them and women don't. So I just want to there is a systemic problem,
Yes.
which is that we don't have enough primary care physicians in this country. We don't have enough OBGYNs, but honestly, we also don't have enough cardiologists, neurologists, endocrinologists. We have a huge shortage of expert care providers. So that's true for men and women, just to say it, right?
And
So
thank you for saying that because I do feel like I will say when I talk about women's health, the men are like, "What about the men?" So I'm glad
yeah,
you started that
I
because
think
we
that's
do have to
important.
set that stage.
I think that's really important. Honestly, we have a systemic problem in this country that we don't have enough healthcare providers. And then we have a problem of how healthcare is paid for. A lot of these things are the spectrum of primary care. Primary care is massively undercompensated as opposed to specialty care. So the medical system barely pays, if at all, enough for a primary care doctor to do break even doing 30 visits a day in order to break even. To be clear, they don't pay per visit almost anything. So the system is designed not to take care of primary care patients. That's how the financial system is designed. So the um, specialists make more money The real money goes to procedures and cancer and treatments for, cancer. A lot is cancer. A lot of money goes into cancer. A lot of money goes into stem cell treatments. Like, so we have it is a systemic problem for both men and women. It is how it is financially designed. And I think it's really important to understand that, because when you say that people are thinking about cost savings, it's because, again, the financial system pays for certain things. And if you can't get your product paid for, it can't succeed. Like, you cannot create a company in this ecosystem that is successful without insurance. You can have a little teeny company. You can have but in order to have a big company, you got to get insurance. We have to give access to all people to
Yes.
give good care. It's got to get covered by insurance. You got to get paid for, and it pays very little for primary care. So I just think it's really important to understand those facts, because then what's happening is, like, we default OBGYNs, and we say, well, why don't they know everything about menopause? They can't make money doing it either.
Right.
So we have a financial system that doesn't work for this. And I mean, that's what we're trying to solve at Midi. But just to be clear, like, this is not sexism. It is actually a financial system that doesn't work, or it works, but it doesn't reward the things that you and I might prioritize.
Exactly. And you're seeing even so many midlife clinicians that are going cash pay. I actually just had to switch OBGYNs because mine now no longer takes insurance. I got an appointment with an OBGYN. I wanted to move it. I can't even move it because they don't even have appointments. And
Yeah.
then on top of that, I don't know if you've heard about the paper that doctors Jocelyn Fitzgerald and Dr. Louise King and a bunch of others co-authored, where they analyzed even reimbursement for procedures, which we say are the money makers, but the reimbursement rates for even the same procedure done on a woman versus a man, the reimbursement is ridiculously low, like 50% or more in some cases is the difference.
Yeah. No, I saw that paper. It's fascinating.
Yeah.
So those are the things that we're fighting against, right? So you can't there is a market. People are going to go toward where there is money. This is
Yes.
how things work. And historically, midlife care does not, and preventive care in general for men and women, is not well compensated.
No, it's not. And so how can I mean, again, you founded Kirby, you've been in investment and healthcare is a business. And so you mentioned having reimbursement is so important for success, but what are some of these other factors? And because here's what I will say is so much, especially on LinkedIn, it's women's health is underfunded, it's under researched. And the data, it's just this constant, and we need to have that information out there. But I guess I want to have a productive conversation about it. It's like we got the data, got it. Okay. So what do we do now? And you're so experienced in this space. You're building another company. Like, what do we do about it?
We build big companies. That is the answer. I mean, I actually have to say, perhaps this is going to be controversial, but
I
yes,
love controversial topics. Go for it.
yesterday, Melinda Gates, along with the Wellcome Trust, announced that between the two of them, they are putting $100 million into researching women's health issues. And that was celebrated. And I was so sad, because $100 million is nothing. And if we rejoice that the richest person is giving us, she's giving 50. So the other Wellcome is giving 50. If we rejoice that that's huge, then we're really selling ourselves short. So to change the paradigm of women's health is going to require billions of dollars in investment, which will return multiple billions of dollars to investors. But that's the mindset we need to have. If we go and rejoice that someone's going to put $50 million into a whole lot of little teeny projects, that's not success. We don't need a lot more little teeny projects. We need people to fund big projects that will make a big impact. And we better off choosing one company, giving them 100 million and proving that can return billions, and sprinkling it around. And a lot of women are doing that. They're sprinkling the money around into lots of little teeny projects. But then there's not enough money to keep funding the Series A, the Series B, the Series C. And we have to fund that whole ecosystem. And so I feel like we're losing the thread when we focus on little teeny projects.
Yep. No, I completely agree. I mean, I'm the EIR right now for Springboard Enterprises, and I'm seeing firsthand it's that Series funding, and there are amazing companies out there, and they just can't get the money, and it's incredibly tragic. So someone had asked me once, if you could wave a magic wand, what is it that you would do? And I said, honestly, I would look at all the diseases that disproportionately impact women, that differently impact women, and that impact women alone. And I would look at the burden of disease, the population impacted, what is the data we know now? What is it that we don't know? And strategically fund the gaps in those areas to then figure out what is it that we need to build to help these patients. Because you are right. Like, I started an endometriosis working group. It's in its very early stages, and I've had many people fill out this survey. And my head is just spinning because my whole goal is, if we could take this condition and do for it what was done for breast cancer, where it's very aligned. It went from this shameful, never talk about I have breast cancer condition to a movement. With endo, there's no great diagnostic except surgery. The treatments, surgery, or, drugs that people aren't loving, and the patients are suffering. It's taking 7 to 10 years to get diagnosed. And when I'm looking at this early data, and the biggest gap is funding, everyone's stuck. So how is it that we can help motivate the people who do have the big dollars, and how do we right size where the funding is going? Because you have done an incredible job. Like, I've watched you from the beginning, and the minute I saw your company and what you were sharing, I knew you would be a success. Like, it was, like, so clear. Like, you knew exactly what you were doing, and you had this. So how is it that you were able to make this a big company?
So a lot of it is we didn't start off we start off with standard billing codes, right? We didn't say we're going to go try to do something and prove to an insurance company that they should pay for something they haven't paid for before. Instead, we very purposely started out with standard billing codes and figured out how to make our company successful within the existing ecosystem, as
Okay.
opposed to saying that we were fixing a broken system. I think it's much easier to do what we're doing. I mean, in a weird way, that uh, let's say it is a broken system. What can we do within that broken system, as opposed to trying to change a paradigm? But honestly, I mean, our company is doing great because we're offering women what they need. And we know what they need because we talk to them every day and we listen to them and we hear what they are asking us for. And then we change what we're offering to make sure we're giving women what they need. And that's we're not going into this with any preconceived notions about what it is that they're looking for. Um, I laugh a lot about hormones. There are 10 companies that are all going into the hormone selling space, right? Just all these companies, I'm going to go sell hormones. I'm like, got to tell you, women are not looking to buy a hormone. Like, that's not what they're interested in. It's so funny. Like, they seem to think there's a new gold rush. Instead of selling GLPs, we're going to go sell you hormones. Women are not interested in buying a hormone. Women are interested in being taken care of. They're
Yes.
interested in being heard. They're interested in someone understanding all of their issues and helping them to feel better. That's a very different mindset than selling them a hormone. And so I laugh. People are like, oh, you have 10 competitors. I'm like, actually, I don't, because I am not in the hormone selling company. I'm not in that business. They can all go compete with themselves to go. I mean, less than 4% of women in this country take hormones. They can all go fight to get those people to take their hormone instead of someone else's hormone. But where our argument is different. Our argument is women need to be taken care of. They want to be listened to. They want to have someone who understands their bodies and who can help them. And so that's what we do, which is a very different model.
Yes, that makes sense. So then let me ask you this. One of the observations that I had early on when I started in the women's health space is in the fertility world, it was very clear women would do anything because it was, if I don't do these things, I can't get pregnant. I have found outside of that, it's women don't take as much action. And so it's so fascinating that you're having success with midlife, where can I just tell you how many of my friends I speak to where I just say, please go to your doctor and here are all the things they can do for you that are really easy and you will stop suffering. And they don't go.
Yeah. Right.
So, how, like now looking deeper, because clearly it's understand your customer, don't try to fix a broken system, be very clear on what you're doing. But then, how is it that women then say, okay, fine, I will use this thing? Because that's another part that we all have to take into account. So,
Yeah.
I'm curious what your observation is on your end.
It's funny. I post things on my private Facebook to 1,000 friends, and
Mhm.
I'll post research and I'll post things about Midi. I've been doing this now for 4 years, right? And people are now coming for the first time to Midi. Like they're like, "Oh yeah, I finally made a visit," and I laugh, and I was like, "Why did you wait 4 years? I've been telling you for the past 3 years you could sleep if you came to me. Why did you wait 4 years?" And they do. They wait 4 years and then they come and they go, "Oh, thank you. I'm sleeping." It's like, I think you could have slept earlier. But, we don't take such good care of ourselves, right? Like we don't prioritize ourselves. We're busy, we're taking care of our children. We don't often prioritize ourselves. And we're also willing to really not feel great. We seem to be willing to suffer a lot, right? Like there seems to be this idea that it's okay to not sleep or it's okay to have anxiety or, a number of women come to us and they haven't had, sex with their husband for many, many years and it has hurt and so they got scared and they didn't reach out to anyone to try to figure it out. They were just kind of embarrassed or scared or like it's so I think we do need to prioritize ourselves. And then I also think you do need to know there are solutions out there. If you don't know there's a solution out there, then you're not also likely to do anything about it. But you know what is so interesting? They're all taking pot.
The C I have a friend who is, like, obsessed with CBD gummies. That
Yeah.
came first, and then finally, when she decided to go on hormone therapy, and again, I'm not saying everyone needs to be on hormone therapy, but I will say it is quite magical, it changed my life,
Right.
is she said she couldn't get out of bed without grabbing onto the heating unit to pull herself out because her joints hurt so badly. And that was what finally did it. Not the anxiety,
Yeah.
not it was I'm sick of doing this, right?
Yeah. No,
And
no, no. They're popping CBD gummies and they're not talking to the doctor, right? Like it's a weird dynamic.
it is very weird, but I have many friends because of all the work that I do, and I'm so open that they actually do come to me. So I feel like those of us in this space are the truth sayers who people will. So I hear all the sex feels like razor blades, and I educate them and beg and plead. So we do have to do that. So I guess for those then building in women's health, so I'm hearing try not to like necessarily fix a broken system out. Although there is a company, I think it's Alara Health, that's doing PCOS, which to me that is also fixing a broken system, but within
Yeah.
the realm, kind of like what you're doing. So that's wonderful, and I hope she has great success. I know she had successful raises. But I guess maybe are there mistakes that you're seeing companies in this space make, like any obvious ones? Like you're busy running your company, but so you may not be able to watch everyone, but I'm curious if there are other things that we need to be aware of and do a better job of to help these women.
Well, so, you know, I think understanding venture capital is really important. So, venture capital exists to support a specific type of business, right? It exists to support a risky proposition that could return a X to a fund, right? And I think one of the mistakes a lot of women health companies make is they are unable to paint that big picture on how large of a company they can be creating. And that's really hard because then they get really frustrated. They don't get funding. But the venture capital is not here to solve social issues. Venture capital is here for venture people to make a lot of money on an investment. And so when you opportunity to investors, you need to be able to paint a picture of how big and how much revenue eventually your company can generate. in a very rational path on how to get there. And I think that's very hard for a lot of people.
Yeah. And I do see so many people entering this space from a place of passion and not really understanding the business of it. I mean, look, I started with a startup and I immediately pivoted because I saw that women retrospectively all wish they had that tool. Prospectively, no one thought they needed it. I'm like, I don't know how you create a business out of that. Like how do I sell this theoretical idea that should work that is not going to make revenue for a venture capital firm? And I think, a lot of that and I hope that women who are listening to this also understand like this is what happens behind the scenes. So if you're frustrated, we are dealing with a very complex healthcare system. We are dealing with the fact that it's, money making business, sadly. It's just how it is and we have to face it. There are so many people trying to do good, but it's really hard because it can't be just a passion thing. It sadly has to be structured in a way that is a business. But then what about these conditions where they're under research? Is this where like the, Pivotal Ventures would be maybe funding a disease and like the government funding a condition to better understand it so that startups can flourish out of that research? Is that really what we need next?
I mean, we need investments in every part of this ecosystem, right? We all know we need investments in every part of the ecosystem.
Yes.
One of the things we're doing is using AI to pull the research. So there, as you mentioned earlier, there's so much research actually happening that none of the doctors actually know about.
Yes.
So, right, one of the challenges is taking the research out there and actually translating it into something that is actionable and then putting that to work.
Yes.
So we have some really cool AI tools that are actually, looking at here's all the new research coming out. How is this applicable to our audience? So it was actually pretty interesting. There was some research done on thyroid, and there was a biomarker and a blood indication that would suggest that a certain medication would be appropriate for people. We read this article and like, oh wow, like that's pretty cool. So we went and looked at all of our patients, and we found there were like 250 of our patients that would benefit from this medication. So we emailed them all and said, there's this new research, there's this new medication. We would love you to come try it. I mean, up to you, but come talk to us to see if it's appropriate for you. So I'd like to kind of change that paradigm so that there is a huge gap between the research and it actually getting to patients. So that's
Yes.
a gap that we're trying to close.
No, that's awesome. And that's something I've also observed is we need to meet the women where they're at and having a centralized structure like you have, where it's nationwide and you're really looking at this specific phase of life. You do have a centralized way to do that because one of the data points that I've seen, and I don't know if there's been updated research, so it could potentially be outdated, is from when research is conducted and guidelines are set, it can take like 17 years for it to change clinical practice. And like the GSM guidelines were just published. I'm very curious how many clinicians who see women in midlife who need treatments for GSM know about those new guidelines, right?
Why don't you say what GSM is just for people in your
Thank
audience?
you. Thank you for reminding me that. So it's genitourinary syndrome of menopause. And because of the hormone changes that are happening, things like recurrent UTIs, dryness, all of the pain with sex, all of that stuff starts to happen. And by the way, that can also happen if you're taking birth control, which I learned from another clinician that I interviewed. So it's not even just a midlife thing. Anytime you're having those massive hormone changes in all the different phases of life, it can happen. And I've always like years ago I said if only all the EHR systems would take all the data and feed it so that when the people come see their clinicians, they would have it there. And I don't know how much they've done that. It sounds like you're definitely doing it. Maybe they can take a lesson from the efforts that you're putting into place.
I think that actually you're actually getting at another one of my bugaboos, which is emerging research. So if I have to wait till we prove the connection between estrogen and dementia, I will be dead.
Yeah, I know.
Right? So I need to take the emerging research and translate that and say, okay, if there's no damage and there could be some benefit, let's offer this. And it is a new way of thinking, right? But I I think it's important to give people access to emerging research as opposed to pure evidence-based proven things, because it just takes too long. And if there's no evidence of harm, then I don't know why we wouldn't do it. Like, I was asking a cardiologist about this the other day. Like, there is emerging research that estrogen is positive for cardiovascular benefits, right? Especially in the first 10 years of menopause. How much more evidence do they want?
Yeah.
And how long do we need to wait? And I decided we don't need to wait. So I can tell you the risk benefit analysis and you decide what you want
Yes.
to do. Let's give women the options and give them the research and then let them choose what they do and what they don't do.
Yes.
And, I don't want to wait the 17 years until I'm, and
Exactly. And another thing I want to share with folks to echo that is I remember I went to the Women's Health Innovation Summit, that's what it is, in Boston. And there was a researcher sitting on stage who was a woman, and she said, I am embarrassed to say that I have not done as much research on women because I am incentivized to publish fast and published often, and it's easier to do research on men, so I don't do it on women. And so if we wait for all, you're absolutely right. And another example, the way I was able to get pregnant, I had to go to this clinician who he specialized in uh, he was a reproductive immunologist, and someone who works at one of the big academic medical centers. She said that's voodoo because it's not published.
yes.
And I'm like, but he's a private clinician who's running a busy practice. And I have gone to everyone else doing all the standard things and nothing has worked. So I'll take what you call voodoo. And if I would have listened to her, I would not have my child.
Yeah.
And, and so I think we both agree true voodoo, like we don't want to push that on. But if we have enough data, and this is where I'm loving the fact that there's AI and all of this other data out there, because hopefully that will speed up being able to compile all of this information in the absence of the funding for clinical trials.
Yeah. No, I think that's right. So I think that's the kind of thing we need to be looking at, right? Like, yeah, and women have been our worst enemy, right? Oh, well, it's not proven. I don't have 20 years of data, so I'm not going to give it to you. Well, I think that's just ridiculous. Like, let's try it. If it's not going to damage you, why not try it? So it's a different, that's my paradigm.
Yeah, no, it absolutely makes sense. I'm excited to share that I'm interviewing an AI expert because I see so many people using AI, right? And some of the questions that I have for her are okay, we say that if we don't properly build information into the infrastructure for women, as an example, then that's going to impact later how the output comes with the AI tools. Sorry, I'm using all the wrong words right now because they're not coming to me, but you know what I'm trying to get at. So, like, I really want to understand from her to educate everyone, like when people are saying AI, what are the questions you should be asking about these tools so that we can make sure we're getting the care that we need. And that's so important. So I'm so excited to have that conversation. And I'm really excited that you guys are using AI too, because it's so important.
Oh, yeah, we use it for everything. It's great. It's a wonderful tool.
I know that so many people are struggling, but I know it sounds simple in the way that you're talking about it, but I think when someone's in it trying to build this company, it may feel more complex, but hopefully just the way that you've explained it really, really helps. And I guess maybe I do have one last question is I hear that venture doesn't get women's health, so they just don't want to invest. And I hear a
I
lot
don't
of
think
that.
that's
How
true.
true? I'd love to get your perspective on this.
They don't understand the business. It's not that venture doesn't get women's health. They're not a nonprofit.
Okay. Okay.
Their job is to make money. Period. They have investors. They have a fiduciary obligation to their investors to make money. Also, the venture investor you're talking to wants to keep their job. You need to present a very persuasive case to that investor why you're going to make money. And I will tell you, I mean, for us, when we did this 4 years ago, we got turned down over and over and over and over again. It's not like we just had money coming at us. We got a little bit of money. We started proving it. Then I went to a lot of those same people who turned me down and said, look, I'm proving this. They turned me down again. And then I kept proving it. And then I went back to them again. And you know what? They invested. And so this is not a one shot deal. If you can show a partnership, a venture partnership that you can execute, that you can grow, that you have a good basic business model, that you have a good cost of acquisition, and you have a good LTV, and you're addressing a big market, they're very practical investments. Is it true that they might not understand women's health? Yes, it is true they might not understand women's health. But it's your job to explain to them why this can be a good business. Their job is to go back to their partnership and convince that partnership that you're worth investing in. And so I think it's a relationship building exercise. They are taking risk to invest in you. So show them why they should take that risk. I would not get angry. I would just keep going and building and proving what you're doing. And if you have a good business model, I think it is likely that you will get funding if you keep going and just proving it out. But getting angry at the system isn't going to help you at all, because we do have a system. I had a bunch of meetings at a very large financial institution yesterday. It was a big investor conference, and all men, of course, they came in person after person to the room. And every one of them said, we would love to invest in women's health. We just haven't found a company that has shown us a story that we felt like we could go present to our partners. So
Interesting.
I don't think that they're trying to discriminate. They're really not trying to discriminate. You got to show them a story that is worth their sticking their neck out for you. And
Right.
that's hard.
But some of the investors are pharma. And I know that, recent trials haven't succeeded for certain conditions with it, which is scary. Even this dynamic of what you mentioned with Pivotal Ventures giving the $100 million,
They
knowing
gave
that
50. Wellcome
well,
Trust
50
gave
each. You're
50.
right.
Yes.
You're right. 50. Thank you for clarifying. And, the fact that we need research and then pharma operates the way it does. I'm curious where you see the role of pharma playing in the investments, given the media keeps saying they're getting out of women's health.
I don't think that pharma is getting out of women's health. I think that's a misnomer. Pharma is also a business. Honestly, the GLP-1s are women's health. More women take GLP-1s than men. So in many ways, pharma companies are women's health companies. So I actually would look at it very differently. Like, I don't think they're getting out of women's health. If you're saying they're getting out of an orgasm pill, maybe they didn't sell a lot of an orgasm pill.
Right.
Okay, but that's very different than getting out of women's health.
Yes.
So it's really how you're telling the story. They're not stopping taking care of women. They're not getting out of women's health. They're investing where the money is. And there's a lot of money in women's health, in diet, in nutrition, in weight loss, in Alzheimer's, in cardiovascular disease. All of those are women's health issues. And pharma is putting big money there.
Yes. Well, let's hope the conditions that impact women alone, we can figure out that path out too, because there's a lot of things that we need there as well. Well, this has been such a great conversation, and you're the perfect person to have spoken about this, because given your background, and this is very fact-based, and we need to really get fact-based to have perspective. And I think this will help anyone in this ecosystem, whether you're a woman struggling to navigate, we now understand like what is going on behind the scenes. And just kudos to you for continuing with those pitches and believing in this and really building it as a solid business, because it is helping so many women. And I hope that everyone who listens takes away something. We did go to a lot of different places, but I think understanding those nuances is so incredibly important. So I really, really appreciate your time.
Thank you. It was really fun.